Hi, I'm Heather Robles. I'm here to talk to you today about plasma nucleosome concentrations as a tool for treatment and disease monitoring in tumor-bearing dogs. Nucleosomes are small fragments of DNA wrapped around a histone octamer that make up the very basic units of the chromosome. During cell death, fragments of the chromosome are released into the blood as nucleosomes. Nucleosome remodeling has been implicated in both the genesis of cancer as well as metastasis, and neutrophil extracellular traps or nets generated by nucleosomes have been implicated as a cause of disease progression or metastasis in humans. Circulating nucleosome concentrations have been used as a surrogate for measuring treatment response to chemotherapy or radiation therapy in breast cancer, non-small cell lung cancer, and colorectal cancer in humans, among others. Additionally, elevations in nucleosome concentrations have been seen in dogs with lymphoma, hemangiosarcoma, histiocytic sarcoma, melanoma, and other diseases. However, no data exists to determine what happens to nucleosome concentrations during treatment. For this study, we enrolled dogs with newly diagnosed cancer at Texas A&M Oncology Service. Dogs had blood drawn at each visit, starting with diagnosis through treatment and rechecks. EDTA plasma was isolated and frozen at -80, and then analyzed later in batches. We did standard ELISA, sandwich ELISAs for thymidine kinase 1 and H3.1 nucleosomes. The ELISAs were followed according to manufacturer's instructions. The plates read at 450 OD, and data was analyzed using Excel and GraphPad Prism. CRP was also evaluated, and this was run by the Texas A&M GI lab. 21 cases were enrolled. You can see in the bright column over here, this is the nucleosome concentrations at diagnosis for each dog. About half the dogs had lymphoma, the other half had a variety of other diseases. Here, what we found was that most dogs were able to achieve a healthy dog remission status. The time to clinical remission is noted here in the right column, and this is based on information from the medical records. Here in the left column, what we have is a percentage of dogs who had nucleosome concentrations within the healthy range below 67.4 nanograms per mil. At the time of clinical remission, however, many of the dogs still had elevated nucleosome concentrations well above that healthy range, and it took a lot longer for these dogs to get to that healthy range than it did for them to get to clinical remission. However, that time difference is noted here in this column. To go through a few individual cases and show you what we see, this is a dog with stage 4A B-cell lymphoma who initially had a pretty high presentation with nucleosomes above 600. She was treated with CHOP, and here you can see she had a few ups and downs throughout the CHOP protocol. Most of these spikes follow either a delay or right before doxorubicin. She did end the protocol at a normal healthy range, but that was short-lived, and the nucleosome concentration started to rise until she was noted to be out of remission at her 4-month post-CHOP recheck. She was reinduced with CHOP chemotherapy, had some ups and downs, but since then has been a lot more stable in her nucleosome concentrations with this second CHOP cycle. Our next dog is a dog with multiple myeloma who was just above the normal reference range at diagnosis. When we treated him with radiation and chemo for bone lesions, he had significant die-off, and we believe that's what's illustrated here with his elevation in nucleosome concentrations. What we did find is that he does tend to have an elevation in nucleosome concentrations just before he is noted to be progressive, about 3 weeks beforehand. Our next dog is a dog with osteosarcoma. This dog had a normal nucleosome concentration at diagnosis, which is something we typically see in osteosarcoma patients. However, as time progresses, we start to see a slow rise in the nucleosome concentrations until we see evidence of progression on chest films. And our last case is a dog with a metastatic pulmonary carcinoma who was treated with chemotherapy. In this case, we see that the nucleosome concentrations do correctly predict disease progression just about every time. So in summary, nucleosome concentrations can be used to monitor for disease response and progression. And nucleosome concentrations did reach normal levels in most dogs who achieved clinical remission. These concentrations, however, lag behind physical exam findings of clinical remission, showing that nucleosome concentrations may be a more sensitive measurement of residual disease. Finally, elevations in nucleosomes tend to precede clinical evidence of progression, However, because other factors can cause elevations in nucleosome concentrations, we recommend at least 2 consecutive elevations before changing your protocol. Thank you so much for your attention. If you have any questions, please check out my poster and feel free to email me. Thank you so much.